Got to unmute.
There. We'll officially call this meeting to order at 18:04. And as usual, our meeting will start with the approval of the minutes from our last meeting.
So yeah, it's actually the on the agenda, I put the approve of minutes from December 8th, which is the last regularly scheduled meeting. But I would also, and I know you've received them, the minutes from the special meeting on December 15th. So if you could look at both of those, I'm sure you've reviewed them and approve both at the same time.
Okay, I make a motion to approve the minutes from the December 8th meeting and the special meeting held on December 15th.
I second Margaret's motion.
State your name, please, Stan.
Stan Stremko, I second Margaret's motion.
All in favor, Juanita Carnes.
Margaret Duty.
Stan Stremko.
Okay, good. And before we get to the next item on the agenda, it is just a housekeeping thing where we have a new clerical staff here in the health department. So we have a new office manager. And so now we have two. We have one up at the transfer station, and we have one here in the health department to help us gel everything together. So what I'm asking is for the board to authorize signature authority for Kim Sinkowitz, who's the health department office manager, and that's for everything, our payroll, invoices, maintenance, transfers, schedules, asking for her to have signature authority.
Okay, I make a motion to approve Kimberly Sinkowitz as having authorization to sign such documents.
Second, all in favor by roll call, Juanita Carnes.
Margaret Duty.
Stan Stremko.
Okay, so we'll move into public participation, and I will defer to the chair to get that started.
So public participation, as you all know, is 3 minutes per person over a 15-minute period. We will be timing this. I just want to say a few words before we start this. With rights come responsibility. Every speaker has the responsibility to be civil. Civility involves the display of respect for those who have positions with which one disagrees. Disagreement plays a necessary role in government and many things to make the process work, but how one expresses that disagreement is of the utmost importance. If any participant on our meeting acts or speaks in an uncivil manner, their right to speak will be terminated. The elephant in this room or on this Zoom call is the mask mandate. Despite the opposition, I can speak for myself and I believe the other two board members, we remain strong in our decision, and the numbers out there and what's happening in the world backs that up also. And I just want to remind this community that this board is made up of 3 community-minded, educated, experienced individuals. Margaret has 40 years on the city health department. Dr. Stremko and I have approximately 70 years of patient care experience between the two of us. We have also worked from day one of this pandemic in the trenches. We have worked with those critically ill and dying from COVID. We have consoled family members. We have counseled people on everything from vaccines to quarantine, to masks, to everything to try to help people personally in their health. We keep up to date with continuing education and especially COVID and just pandemic. Again, solitary and mission on this is the public health of this community. To quote the CEO of Mass General, those of us in healthcare have done our part and more, but we can't do it alone. Public health requires, well, the public to do their part. As much as we believe in the power of individual choice, There are times that require individual action for the common good. This is one of those times, and the public can take actions that are simple, even if not easy, and effective." End of quote. We implore this community and its community leaders to do their part, and we thank those that already are. So with that, we'll start public participation. Joe, what are the mechanics of it with the Zoom?
So there is an option for the people present to, I believe, do a virtual hand wave, and or we can do regular hand wave. That's fine. Juanita, if you have gallery view on, and it looks like there are 3 pages of participants here. So when I'm looking at the first is the ones that have video, and then the other 2 are people that don't seem to have video, but there is the option to virtually raise your hand there. So I will monitor that, and Juanita, like I said, I mean, I feel like it's you that would be calling the participants forward to speak. And so right now, I think one of the hands I saw go up first was Lou.
I saw Lou and Susan Barry first.
Okay, well, call on whoever you wish.
So we'll start with Susan Barry. Please state your name.
And unmute yourself.
Unmute.
My name is Dr. Susan Barry. I have a doctorate in clinical psychology. I'm here to tell you that while children have very little risk of serious illness from COVID, they are suffering the greatest toll psychologically during the pandemic. Children are absorbing the sense of constant fear, and they have their own physical reminders of it, wearing a mask all day in school and constant pressure to get vaccinated against a virus most of them will not suffer from, but the long-term effects of the vaccines for which we have yet to discover. Studies from around the world have shown mask mandates are interrupting young children's continued learning of nonverbal communication through facial expressions. The ability to match facial expressions with feelings is obstructed. Masks invite children to avoid eye contact with others. Children who already have difficulty with eye contact, such as those with attention deficit disorder, that problem is exacerbated. A study in August showed children born during the pandemic were found to have significantly reduced verbal, motor, and overall cognitive performance than children born pre-pandemic. In the aftermath of mask mandates and the pressure from adults to get vaccinated, psychological symptoms have increased dramatically among children. Mental health visits have increased. Children who previously exhibited behavior problems, those problems and behaviors are exacerbated, especially among teen girls, where our own CDC has seen a 51% increase in emergency room visits for potential suicidality among this vulnerable group of girls. Child psychiatrists and medical professionals who have studied the mandates say we must reduce the fear factor for children since they suffer the least from COVID disease. They urge that COVID is actually a very safe disease for them, and they should not be worried about the impact of COVID on themselves or their future health. They add that mandates such as masks and pressure to be vaccinated are more detrimental to children's health than the virus itself. Early estimates from the National Center for Health Statistics are suggesting that in 2020, when the pandemic began, more than 6,600 deaths by suicide were seen among the 10 to 24-year-old age group. That's more than 10 times the deaths that could be attributed for that age group to COVID. I ask you to please relieve the children of your district from this burden. You can see links to the studies I've cited at lumennews.com, LUMEN-news.com. Thank you.
Thank you. Lou?
Yes, my name is Lou Tulik, and I would like to make it clear that I am not anti-mask, as masks can and do save lives when they are used in accordance with OSHA, FDA, and CDC protocols. I have been a trainer in the Homeland Security Weapons of Mass Destruction program, where I instructed first responders on the proper measures to take when responding to hazardous events, including biological weapons. I have utilized masks and respirators in the field, and I'm well aware of the procedures that must be met when utilizing these devices. When those with no expertise in masking espouse the saying, "It is just a mask," they are ignoring the fact that these devices require adherence to protocols in order for them to be effective. Most of these devices are single use only, meaning they must be disposed of after they are contaminated from coughing, sneezing, and talking. Cloth, fabric, and surgical masks do not meet the definition of respiratory protection under the FDA and CDC. N95 masks are not masks, but are defined as respirators, and OSHA requires an annual medical exam, fit test, and a clean-shaven face for them to be effective. They are also not meant for children. These are complex devices that require a seal to the face to limit exposure. Schools requiring N95s are either not aware or are being reckless. In fact, many public safety agencies across the country use N95s improperly when responding to scenes where fentanyl is present. Even when worn properly, N95s are not capable of protecting first responders from fentanyl
Board of Health meeting.
as they are smaller than the mask's safety rating. The proper mask for aerosolized fentanyl is an N100 level device. It should be noted that fentanyl is 5 to 10 times larger than the size of a COVID particle. This means N95s are also ineffective for COVID. When mask advocates cite studies that these devices are effective, they cite studies where sterile, dry, properly used masks are tested in controlled environments for limited durations, usually less than an hour. They do not test masks that have been in pockets, tables, rear view mirrors, or hanging under chins. They don't test masks that have been worn for hours at a time in schools or at workplaces. These masks, when damp, become vectors for bacteria and become literal petri dishes. They accumulate exhaled breath emissions concentrated on a piece of fabric on faces for hours at a time is contrary to proper mask usage. Touching the mask, placing it on a table, around the wrist, or putting it in one's pocket may seem a benign or inconsequential to many, but it essentially destroys any integrity and efficacy of what little protection the mask provides. In the study of industrial hygiene, the hierarchy of controls puts masks at the bottom of the pyramid of protection. I would offer this information be considered prior to implementation of a mask mandate as to what you may feel in the best interest of your community may be in fact detrimental, at the very least have no positive impact. Thank you.
Okay. I'm just gonna scroll over to real quick for people that aren't necessary. Well, it looks like, Juanita, do you want to call on? It looks like Counselor Ali was,
I think Jessica had her hand up before him.
Okay.
Jessica?
All right. So I want to talk about, well, Jessica Britton, second opinions. When we get the opportunity of second opinions, when we see the doctor, when we service our automobile, and where we shop, and most importantly, where we gather and research topics of care. That's how we make informed decisions. When science cannot be questioned, it becomes propaganda. We asked you guys for your science on the mask mandate. I have yet to see anything, and yet I'm supposed to be an obedient little citizen, don on my mask of compliance, and not seek a second opinion. The verbiage for the mandate was a direct copycat of East Hampton. Where is the originality in the data and the facts? Science is always changing and must be questioned and rerun continuously to prove its validity. We keep running the same non-effective measures as a child that clings to a security blanket and hoping for different results. Isn't that the definition of insanity? Real doctors and medical professionals weigh the risk and benefit of any medication, therapy, device, or intervention to the individual patient risk profile. A one-size-fits-all mandate does not do that. Doctors ask 3 important questions before doing any of those intervention therapies or devices. 1, is it necessary? 2, is it safe? And 3, does it work? The truth is we do not know the short-term, let alone the long-term ramifications of wearing a mask. Everyone is looking to efficacy as how well it works versus the effects, the side effects and dangers. However, the science is still out. One study I found is called is a mask that covers the mouth and nose free from undesirable side effects in everyday use and free of potential hazards. This was published in April of 2021 in the Interventional Journal of Environmental Research and Public Health. The authors wanted a comprehensive investigation as to the adverse health effects of mask wearing. They whittled the data down to the most scientifically relevant 44 experimental studies and 65 publications over the last 20 years. The literature revealed adverse effects of masks across multiple disciplines and a variety of cascading pathophysiological cellular breakdowns that affected healthy individuals, let alone those specifically altered through disease state pathogenesis. They saw consistent, recurrent, and uniform presentation of psychological and physical deterioration, as well as multiple symptoms that were referred to as MISE, mask-induced exhaustion syndrome. The respiratory physiological of mask wearing has significant correlation in O2 drop and fatigue, inverse relation of CO2 rise, headaches, respiratory impairment, temperature rise, and moisture under masks. I have more, but I'm up.
3 minutes, Justin. Thank you. Juanita, do you want to call the next participant and unmute?
Oh, I don't know how that happened. Sorry. All right, Dan, Alley.
Okay, thank you. Dan Alley, 38 Union Street. During the December 15th Board of Health meeting, no one except for board members, including the mayor, had read the order, which is nearly verbatim from East Hampton, except the fine was increased to about $1,000 a day, which was not discussed. The board did not discuss information presented by residents on the efficacy of cloth and paper mask. It is not reasonable to force school children to wear masks all day when paper masks were not designed for use by children or prevent the transmission of viral particles and must fit properly. There was no discussion of health concerns of prolonged wearing or the need to change masks frequently by people working full shifts, pregnant women, and school children. The CDC changed its position from not recommending masks to masks may help, but will not prevent transmission or be mandated. According to a May 2020 CDC report on emerging infectious diseases, disposable medical masks are loose-fitting devices designed to be worn by medical personnel to protect accidental contamination of patient wounds and protect the wearer against splashes or sprays of bodily fluids. There is limited evidence for their effectiveness in preventing influenza virus transmission, either when worn by the infected person for source control or when worn by an uninfected person to reduce exposure. A systematic review found no significant effect of face masks on the transmission of virus influenza. The mask mandate is based on the emergence of the highly contagious yet relatively mild Omicron variant. The world has known since November 18th when Dr. Angelique Coetzee, chair of the South African Medical Association, who discovered the Omicron variant, told Reuters that the variant had very mild symptoms. On December 28th, the CDC corrected estimates for weeks ending December 18th and 25th, when the agency erroneously reported a 6-fold increase in Omicron share of infections. Former FDA Commissioner Scott Gottlieb stated that if CDC's new estimate of Omicron prevalence is precise, then it suggests a good portion of current hospitalizations from COVID may be driven by Delta infections. I'm concerned that the Board of Health chair made a false statement that the letters from residents were roughly 50-50 in favor and against mask, and no board member corrected this statement after Director Rouse stated that members had read all the letters. A public records request revealed that each member received between 28 and 33 letters with only 2 in favor. No evidence or data was cited for mandating masks, and action by the board gives the appearance that the vote for a mask mandate was predetermined. It is not reasonable to expect people to suspend reasoning and common sense and mandate Westfield residents and others comply with something that will not keep us safe in order to slow the spread of the virus.
That's 3 minutes, Counselor.
Becca Florec is our next and last participant.
I have a few seconds. Can I, 2 seconds?
No, we're on to Becca Florec. Go ahead, Becca.
Am I unmuted?
Yes, go ahead.
Hi, my name is Becca Florec. I have 2 daughters. I am not going to rattle off numbers to you. I am just going to give you what it is like to deal with this day to day. I ask you to put the mask mandate back to choice because some kids are not doing okay with that, and mine or them. We are doing our best to hold it together day to day, but I have a 3rd grader. Her name is Skylar, and she is withdrawn with absolutely everything. She has a skin sensory disorder that was diagnosed before this. It was in preschool. And adding these things to her skin, she doesn't even want to go to school anymore. She's a bright girl. She has a little sister. Her name is Sabrina. Sabrina doesn't like to go to the store either. And I could tell when you guys lifted it and she saw faces out at the grocery store, she was different. She would look at people, and when you put them back on, she doesn't look at people. She's bad at the store, but I saw the change in her when it lifted. She reacts to people that don't have them on. This is real testimony. I promise I'm not going to rattle numbers to you. Please go back to choice. I understand if they're sick, we don't send them to school, but please look into the kids that aren't okay with this. She deserves to want to go to school. I didn't write this down. This is coming right from my heart. So I'm going to tap out now. Thank you.
Thank you.
Thank you.
Okay. The 15-minute time period for public participation has expired. Juanita?
We move on to the next item on the agenda, public health.
Okay.
COVID-19 update and discussion.
So, yeah. So what I just wanted to let you know, I didn't have a chance yet today. Things have been a little frenetic here for the weekly case count. And as soon as we get done with this meeting, I will send this report over to the webmaster for posting on our website. But just to let you know, we were last week for total new confirmed cases, we were at 538. This week we are at 853. So that's a marked increase. The number of unvaccinated cases still account for 73%. And we have had 2 new deaths in this last week. So I would venture to say, without looking back at it statistically, that this is the biggest jump in new confirmed cases that we've seen in a long time. And like I indicated on our website, this does not represent any of the rapid home tests. We don't get informed of that. That's not entered into the state database. So you can only imagine how many more positives there could possibly be out there above our this week of 853 new confirmed cases. And as I always say, the new confirmed cases is not the beat all to end all. It's not the metric that you look at to determine you know, a lot of other things that are happening, but it's just an indicator that obviously we're in a state right now where this variant is very contagious. To go up almost over 300 cases in 1 week, I've never seen that in the last almost 2 years. So my perspective from where I sit in this chair is that there is a reason for concern of that. And also when we see that 73% of those new confirmed cases were from unvaccinated people. Fortunately, and you know, we talk about the kids, we track this because I think it's very important to say that even though you might see, and I know I do, I have kids in the Westfield school system, and I get text messages and emails from the principal whenever they have cases in their schools. And it seems as though those cases in numbers are going up, and they're going up, but in the grand percentage of, in comparison to our new confirmed cases, our kids this week still only accounted for 21%. And we had seen a very long period of time where, and you can look back on the data, where the new confirmed cases in kids, and I'm saying school age kids, were looming around 30 to 32%. So I mean, I'm getting calls from the schools, and they're panicking about the number of students of new confirmed cases that are laboratory confirmed, not home tests. And they're concerned that those numbers are so high that they're not going to be able to do appropriate contact tracing. And it's just going to continue, which is true. That is what's happening. I mean, even though our percentage is 21% of school age kids of the overall number, the fact of the matter is that number is so high and the resources are so limited in the school system that there's only so many people you can contact trace on. So what we've done here in the health department is we've kind of put all hands on deck to try and keep these schools open, and allocated almost all of our resources for contact tracing to the Westfield Public Schools, because I feel like, and also some group settings to try and prevent the spread from nursing homes and daycares and other facilities like that. So what we're up against right now is it's an insurmountable task. It's not sustainable. The resources that we have, and I try to keep bringing in more and more people to do contact tracing. And every time I do, it seems like they get diverted into the school system, which I'm fine with that. I'm fine with it. I think that's a valiant effort. So that's where we are right now with cases and our resources on this end and what we're trying to do. So to keep these schools open and to keep these kids in school, because I can tell you right now as a parent, when, and a lot can go back to what was already said, when my child wasn't in school, it was horrible. It was absolutely horrible. And another thing that needs to be said about, just for clarification of the mask mandate, DESE, Department of Elementary and Secondary Education, is the one that mandates masks in public schools, not the Board of Health. So there's that statement of fact. So, and the DESE requirement was in place before the Board of Health made the mask mandate. So that's the way that goes. Other than that, I think at this point now, that's my report from where I sit. And I think that, as promised, we should revisit the mask mandate and, have the board, I would advocate that you take a vote on whether you want to decide to continue the mandate until the next regularly scheduled meeting. So I'll leave that up to the chair.
Margaret or Stan, do you want to make a motion to continue the mask mandate?
Madam Chair, could I make a few remarks before?
Please.
All right. So prior to our last meeting, I got a call, which I missed, and found in my voicemail after the meeting. It was from Mark Kerouac, who's president and CEO of all of Bay State Health. As everybody knows, 13,000 employees, largest healthcare provider east of Worcester. I think more significantly, though, his specialty is infectious disease. What he said in his message, and confirmed in later communications, was how important he thought it was for our board to vote for a mask directive. He said, as an infectious disease expert, it was in the best interest of the community and also part of a multi-pronged strategy to take pressure off Bay State Noble Hospital, which at that day, according to him, was at 118% of capacity. He also pointed out that the second most senior physician at Bay State Health, Dr. Andy Artenstein, who I also know, strongly advised us to vote for a directive. Dr. Artenstein's specialty is also infectious disease. When I reached out to Dr. Kerouac again yesterday to see if he still supports a mask directive in advance of this meeting, he replied, quote, "Absolutely. We need to flatten the curve to preserve our hospital capacity. Thanks for your willingness to do this." This week, as I found out, we have 853 reported cases. True numbers probably more like 1,500 or 2,000. 1,500 in a week, that's 3.7% of the entire city testing positive in a single week. In the ER, it's all COVID all the time. Last night, I intubated my very first patient, an otherwise healthy, unvaccinated individual with COVID pneumonia. This isn't a theoretical exercise for us. Local and regional healthcare is overwhelmed, and masking slows the spread of germs and reduces the likelihood of infection and death, especially for the most vulnerable among us. Westfield's already had approximately 130 COVID deaths. Our local healthcare facilities continue to function understaffed and over capacity. I've got kids and grandkids. I don't like masks any more than anybody else, but I know it's possible to wear one. I've worn one every day for the last 2 years at work, and that's when I'm not in full PPE. So like everybody else, I don't like the masks, and I'm sick of the pandemic. But right now, we're in the worst moments of the pandemic. And experts like Dr. Kerouac and Dr. Artenstein say that masks and vaccines work. Would anybody here be comfortable if they went into surgery and saw their surgical team was maskless? I know we all hope and pray this is over and things are back to normal and soon. But until then, we're just doing our best to limit the number of people in Westfield who get sick or die as a consequence of this pandemic. That's all. Thanks.
Thank you, Stan.
Thanks, Doctor.
Margaret?
Yes, I would just like to say that, the numbers are increasing. We had no choice. We cannot sit back and watch week after week of numbers increasing and do nothing about it. We have stayed away from mandating vaccines. The next best thing we could do was to ask people to wear masks, mandate that they wear masks. We're coming up to a point, all of the medical advice out there right now is saying that the COVID cases should be peaking in a couple of weeks. I think we need to get through another month and come back and revisit and see where we are, but I definitely support the mask mandate.
Would you make a motion?
Yes, I would make a motion that the Board of Health in Westfield, Massachusetts continues with the mask mandate in place as of December 8th, 15th.
Dan Stremko seconds the motion.
And a roll call vote. Juanita Carnes, yes.
Margaret Duty, yes.
Stan Stremko, yes.
All in favor.
Aye.
Okay, so I guess we're good with the update and discussion.
Peter, could you remove the individuals that are holding up signs?
So we'll move on, and now we're out of that agenda item. So I wanted to, in light of all of everything that's happening in our department, as the resources are limited, and unfortunately through the course of COVID, as has been the case in other departments in the state as well as in the country, people are dropping like flies. So we're a little short-staffed right now, and not dropping like flies because they have COVID, dropping like flies because this is not what quote unquote they signed up for. So we're dealing with resources, a lack of resources right now. One of the things that I'm trying to bolster is in the nursing division. And one of the things that, we can talk about masks all day long. We can talk about vaccine all day long. We can talk about other control measures that maybe should be implemented that we're not doing, that worked before. We can talk about all of that. But on my end, what I need to try and focus on is stopping the spread, not only through the wearing of masks as the board desires, but also in bolstering our contact tracing. As you know, I reported before, the state has disbanded their contact tracing collaborative, which kind of left us out on a limb to do it ourselves. And when you have numbers like they are right now, that's not possible. So in the nursing division, I've done a couple things right now to try and stop the bleeding with the contact tracing part. And that is to establish a new position in the health department of a second staff nurse that can help us with the contact tracing, as well as when we get out from under this in some way, shape, or form, that we can go back to the business of doing health promotions in the community as we should be. We shouldn't be sitting here every day putting out fires and being, reacting to the disaster du jour. We should be more proactive in getting out in the community to advocate for public health. So that's one of the things that's happening. The other is that our current staff nurse here, I have asked for her to be relocated to the senior center so that we can better serve that population of people with needs. So we'll have a health department nurse, hopefully starting next week, that has the senior center actually has a nurse's office over there, which they have only ever filled by grants and temporary employment. I would like to have that and will have that staff nurse from the health department located at the senior center so she can help the senior population. It's very important. They've been underserved for a long time, so we need to get somebody in there. So that's the nursing division update, and that will not reflect negatively on this end with the health department, because we'll have that additional position that will be filled by a licensed practical nurse. So, any questions on that from the board?
Thanks, Joe.
All right. Thank you. Just wanted to update you on that. Things are moving. We're really, and we do still have, I want to say 5 part-time contact tracers that we have employed and we pay to do this. But again, like I said before, they are all allocated to the public schools. We just need to make sure that we do our due diligence to make sure we can keep these schools open and the kids healthy. So that's what we're trying to do on our end. Another part, well, actually it is the last agenda item. As I emailed you a request for waiver of notice and assessment to enter judgment regarding tax lien foreclosure at 11 Howard Street. So this has been a property that we've been involved with for a long time. The law department took it over and filed in land court so that we can go ahead and collect or foreclose, I guess, or collect the amount due on back taxes for this property. It's been many, many years in the making. So the law department asked me to get a vote from the board to accept the waiver of notice and assent to entry of judgment.
Margaret or Stan, do you want to make a motion? Or do you have any questions about this? I'm sure you remember this property has been
Absolutely.
under our surveillance many times.
Mhm. Okay, yes, I would make a motion to assent to entry of judgment regarding the property on 11 Howard Street.
Seconded. All in favor by roll call. Juanita Carnes,
Margaret Duty.
Stan Stremko.
all in
Okay.
favor.
Thank you. That was our last item. And Madam Chair.
And anybody on the board have any other comments or anything else they want to discuss before closing? Okay. This meeting is ended at 18:42.
Make entertain a motion to adjourn.
Thank you, Joe.
Thanks, everybody.
This meeting's adjourned.